Hello, I'm Joe Camp. I've been practicing endodontics in North Carolina for over 40 years and teaching part-time during my entire career. Because of my training in both pediatric dentistry and endodontics, I've had the opportunity to treat hundreds of children following traumatic injuries. In treating young teeth with open apices, our treatments must be geared toward preserving pulpal vitality to allow completion of the roots. This not only strengthens the tooth by having more dentin, but increases retention of the tooth by adding additional length to the root. Here's an example. This child has received a traumatic injury, fracturing the two central incisors and exposing the pulp on the left central incisor. After removal of 2 or 3 millimeters of surface tissue from the pulp, the hemorrhage is controlled with a dampened cotton pellet. Hemorrhage must be controlled before the application of the medication on the pulp, otherwise there will be a failure. White ProRoot MTA has been placed over the pulp, and the tooth will now be sealed with bonded composite, and hopefully this tooth will remain vital and the root will form. This case of a maxillary central incisor is following a pulpotomy treatment as we illustrated in the previous case. Note in this case the open apex, and we'll follow this case then to see the development of the root. This is at 3 months. Tooth has had no problems, patient is fine. We follow it, and at 3.5 years you see the completed root formation and the tooth remains vital. It is not necessary to come back once the root is formed and do a root canal on these teeth. In fact, it's contraindicated unless you develop pathology in the pulp. And then, of course, you would have enough root to come back and do conventional root canal treatment and preserve the tooth. With undeveloped roots, conventional endodontics cannot be achieved. Once formation is complete, conventional root canal treatment, if needed, is possible. Thus, our goal in these patients is to preserve pulpal vitality by doing either pulp capping or pulpotomy. Thank you. I'm Joe Camp for Chair Time.